A renowned bariatric and gastrointestinal surgeon from Delhi, India, talks about his education and experience. In this video, he explains the three main bariatric surgeries: gastric banding, sleeve gastrectomy, and gastric bypass.
My specialization is gastro-intestinal and hepatobiliary pancreatic surgery. I'm from Roux-en-Y Medical College. I have done my MBBS, MS in general surgery and MCH from Roux-en-Y Medical College and associate. My main specialization is related to the surgery of gastrointestinal tract. This I am doing with the open method as well as laparoscopic surgery. And I have been working in various hospitals of North Delhi for last 10 years. I was previously head of GI oncosurgery and minimal access surgery in Primus Hospital, Chanakyapuri. Then I moved to Roux-en-Y Cancer Institute as head of GI oncosurgery, 550 bedded hospital, and it has got all the state-of-the-art equipment available to us. And very shortly we are going to put the radiotherapy machine in the hospital, and we are going in the process of having robotics also available in the hospital. Bariatric procedures, basically we are doing all three kind of most commonly done procedures like gastric banding or the sleeve gastrectomy and the gastric bypasses for the bariatric. It basically depends on the BMI of the patient. Like patients who have got BMI more than 45, in those patients I would rather prefer gastric bypass procedures. But the sleeve gastrectomy is also another very good options if the BMI is more than 40. Gastrectomy is basically a restrictive procedure. In this, we just decrease the capacity of the stomach, and in bypass, gastric bypass surgery, we restrict we reduce the capacity of stomach as well as we add a malabsorptive procedure so that there's a malabsorption of the food we are taking in. So the less nutrients are being absorbed, so the less calories goes into the body. I have been associated with the sleeve gastrectomy. I have not done it myself, but I have been associated with the sleeve gastrectomies. Overall, the sleeve gastrectomy is the safest procedure. Gastric bypass is a more complicated procedure as compared to sleeve gastrectomy and carries slightly more mortality or morbidity than sleeve gastrectomy. But the overall mortality is very less with the bariatric procedures, whether it is banding or sleeve gastrectomy or gastric bypass. But the complication rate and mortality is slightly more in gastric bypass procedures as compared to sleeve gastrectomy. It's a very nice, though it's a very populated country, but it's a very nice and spiritual oriented country, and the people overall here are very friendly and quite helpful, and you get to see a lot of historical places here, and it's a nice place to visit besides medical facilities.
BariatricSurgeryWorld.com is one straight link to affordable weight loss surgery at leading international destinations. Fill out the estimate request form on our site, www.bariatricsurgeryworld.com, for more information. That's www.bariatricsurgeryworld.com. Bariatric Surgery World and its affiliated websites suggest that you always consult a doctor before making a decision regarding any medical trip.